The following events were recorded as they happened at the Hospital for Sick Children in Toronto. On this episode of Life's Little Miracles, Logan's heart surgery, and Aaron swallows a coin. Logan Estabrooks was born 4 days ago in Midland. Upon delivery, Logan had great difficulty breathing. He was diagnosed with transposition of the great arteries, a malformation of the heart. His aorta and pulmonary arteries developed in reverse positions, leaving his body with dangerously low oxygen levels. Now Logan needs open heart surgery to switch the position of his arteries. If surgeons cannot correct the malformation so that sufficient oxygen can circulate through his body, Logan may not survive.
Good. How's your man? How was his feet?
Good. Really good.
Good. Good. You've had a busy week. Yeah, from Friday to now.
Stressful week.
I know. Every day it's been something big.
Yeah.
Have you noticed a change in it?
It's not as purpley colored as it was.
Okay, just let me slip off his
Yep.
sock there. Hey, Logan. Okay, I know my hands are a little cold.
He's got
Okay, I'm
a
sorry.
temper.
Okay.
So.
Right now, what we're waiting for is for him to go to the operating room on Friday, hopefully. Yeah. And then they're going to do the switch where they take the arteries, the aorta and the pulmonary artery, and put them back in the right place. The one thing that may delay that is that he's a little bit jaundiced right now, and it's safer if he's not as jaundiced when he goes to the OR. And what we're doing to get rid of his jaundice is making sure he feeds a lot.
Yeah. Which he is.
Yeah, good. And we're going to get him under some fluorescent lights to help get rid of the jaundice.
Two-year-old Aaron McIntyre swallowed a coin early this morning. It became stuck in his windpipe, and earlier attempts to dislodge it have failed. Paramedics have brought Aaron to the Hospital for Sick Children, where doctors may have to operate if the coin has not moved out of his airway.
And do you have any idea what time he swallowed?
No, he was playing in the room.
8:30 this morning, you figure? Did you see him swallow it, or he just was breathing
I didn't
funny?
see him.
Or you,
He
what
just
made you
started
bring him in?
jumping up and down. I thought he was going to throw up.
Oh, okay. So he never told you he swallowed it?
No.
No.
And she still says he did.
We had a little girl in yesterday. The mom said saw her playing with pennies, and so same thing, she done it, but they also found a big nail in her stomach. 13 months old.
A nail?
Mom's like, yeah, that obviously she'd eaten a long time ago. Okay, so what we're going to do, ENT just want me to get, I'll just get a repeat x-ray done, see if it's moved any. As long as it's on its way down, then we won't. We'll try not to have to operate. That's why they just want to make sure that it passes from somewhere where it can block the airway. If it's just affecting his eating tube, we don't care, but the airway tube, we want to be careful.
This is going to be hard.
Okay.
He's going to fight like they had to tie him down before. No. It's okay. It's okay. Lie down like a good boy, and then we'll go home, okay? I'm right here, sweetheart. I'm right here.
We want just his arms out of the way. We're ready for x-ray, everybody. Good.
Come on.
You okay?
Says my aunt's for the week with her, so we can kind of have...
In town?
Yeah, in Toronto, that's for the week.
Yeah, we don't normally put them in the isolate until they're like 300 or higher, but he's pretty close. This actually simulates the inside of the womb, and they love it. That's it.
Pretty cool, buddy.
There.
Yeah.
All right.
Pretty sharp. You're gonna get all the girls like that, bud.
I don't like seeing him in that. Reminds me of when he first went in right after he was born. That's when they took him away from me. I like the inside.
set?
Ready it's gonna be.
It's tough. Okay. Have any questions, last minute things you thought of overnight? No. And I'm gonna go down with you too, and I'll wait there with you. Okay.
You're gonna stay after your shift?
It's okay. It's okay. That's what I'm here for. I don't mind.
Great, thank you so much.
It's okay. You're tough. You're strong. You didn't sleep very much,
I didn't sleep at all.
You were just holding all the time.
Yep. And take them right away.
Yeah, we're just waiting for the chart. And I'm gonna go give them a quick report and let them know that you're down. Okay.
Thanks. Can you take this soother? Take this soother.
Well, unfortunately, it still looks like it's in about the same place. Not low enough. It probably means you're gonna have to go to the OR because you don't want to leave it in the airway.
That means they don't have to cut, do they?
No, it's like a scope, but they have to do it under sedation.
Oh, God.
See, just what we hope. As long as it's sitting there, it's okay. Now, obviously, he's not having any trouble breathing or anything, right? But just from where it's sitting, if it moves, and gets stuck in the airway, you can't send him home because you don't know until you know that it's safely passed somewhere where it could move to block.
Oh, God.
Okay, it's okay to start.
Am I going to have to yell at you today? Or are you going to behave? Okay.
So now we're going to start switching vessels around. The first thing we have to do is cut them and find the coronary arteries inside. So there's one coronary artery, that's the left one. And there's the right coronary artery, so we're not going to injure him cutting him here. This is the aorta, which is going to become the pulmonary artery. It's very, very short left main. It's not very long, but it's a tight one. That might be a problem for...
All right, dude. It's me again. It's just me again. Why don't you just buy him a piggy bank? And I'm sure Dr. Robichaud already explained to you the deal, right? You saw the x-rays? Everything's... So that's the coin is right there. And what we're going to do is we're going to go in with a camera, see it, and remove it. And if everything goes perfectly, and I'm sure it will, he'll be heading home in about 4 hours after that. And that's the whole thing. Do you have any questions about anything?
Make sure he's okay.
Yeah. Do you have any questions about the Teletubbies? Because I know a thing or two about Lala. Lala and I are like... What about you, Sheila?
No.
What about you?
You're going to take them off.
You want to take them off? Is that where the penny is?
Okay.
Is it in here? No. Is it in here? Is it in here? Where is it?
When he wakes up from...
Where did you put that penny? Hey, where did you put that penny? Did I have to get out? Hey?
Where is it? When he wakes up from the anesthetic or not gonna like it at all.
Oh, you'll see. We do this every day. He isn't going to like it, but he'll be drowsy. He'll be with a nurse who's seen it, I don't know, 17 times already today, who knows how to treat him.
Spastic,
Yeah,
like
and
I
they'll
mean.
call you then as soon as he's awake enough. All right?
Okay. So thank you.
See you, Mr. Guy.
Thank you.
Okay. Pitch flow in half, please. So far the heart looks good. And seems okay so far, Ian. There's just the short coronaries. There wasn't a lot of room to play with it. The heart may be distended a little bit. Close or not.
Hello, buddy. It's me again. I got to show you something. It's a metal detector, a non-ferrous metal detector. And we did a study here last year to show that it's as good as X-rays. So why don't you stand them up in your lap, would you? Hey, check these out, buddy boy. What do you think? Stand up here. You want to blow some? And he'll wave that across him. Get your ring out of the way, Papa.
Yeah, the ring.
Okay, watch this. Oh. That's,
Oh,
you don't like it? It's just like going on the airport.
It actually seems to have gone down a bit, but...
No, it's up by it.
Yeah, no, there it is. Yeah.
There it is. Okay, okay, it's all done, it's all done, it's all done. Oh, and first thing when you're done, we have to have a freezy or 6, okay? You like those? Do you like tomato ice cream? You do? You want one more bubble before I go? There we go. All right, I'll see you. See you later, buddy boy.
Zoom, zoom, zoom. Look what I have. She got a car. A racing car. Would you like to see my car? See a car? There you have it. Look at that. You have things on each of your hands, don't you? That's hard to play then. We're going to go and see if we can find Barney on the wall. I don't know if he's still there or not.
I'll go
And
find
Mommy's going
Barney.
to wait here for you.
Okay,
You wanna
go
give
find
Mommy a
Barney.
kiss?
Give Mommy kisses.
Good boy.
Go find Barney.
Mommy's going to wait here, and then when you wake
It's
up,
okay.
you can
Okay,
have a
Mommy, follow.
popsicle. Okay, darling. Let's go. Oh, I know.
You get to see Mom and Dad because they're waiting for you. They're waiting for you. Don't stop now.
Yeah.
Yeah.
That's a good boy. What a good boy you are.
He has no front teeth, which is a good thing.
Yeah, it's very handy.
Who's that?
That's the baby.
Who's that? Logan? Hey? Logan? Say Logan.
I'm gonna leave the chest open because the heart looks a little swollen to me. And they do a little better if you just give them a little more room for a couple days, and then we close them in a few days when the hearts have recovered and gotten over the operation. This is just a little protection. Give the heart a little more room to relax and work in there. We found what we expected to find and did exactly what we expected to do. Try to close the sternum in, 2 or 3 or 4 days.
Okay.
Depending upon how the heart's doing and how the swelling is and things like that.
Oh, I'm so grateful to you.
And now we have to wait for the next few days to see how the heart continues to work. These children frequently get sick for the first day or two. It's a little bit hard to know for sure, but we have to watch and see and pay close attention. And then the other thing we have to watch for is to make sure we wake up okay and the brain is okay.
Oh, yeah, everything.
You're a miracle worker.
Thanks.
Any questions?
I can't think of anything right now. I'm just so happy.
All right. Okay, he's just getting ready to go to the intensive care unit, and it takes him a little bit to settle him in.
Thank you.
Okay, you're welcome.
Thank you very much. Okay, Jeffrey. There you go. You see it? Yeah, you're looking that way. You all right? Yeah. Okay, because now we're just going to show them. There's the tongue. There's the larynx anteriorly, and there is the opening of the esophagus. There it is. See it?
Looks like a penny.
See the penny? See the penny right there? In a pinch, it'll do, so to speak. Now that it's out. Excellent. Another day at the office. Can we have a penny holder here so I can give it to the parents?
Little bum.
I left it over there.
Just come in. Yeah.
So I'm going to take the sheet off just because it's better that way, and I just sort of did it that way so it's not such a shock when you see everything. Now, did they explain to you that the bone is open still? Yeah. And all of his other numbers are looking okay, as they do.
Where's his saturation?
97.
Oh my.
Yeah.
Good work, buddy. Oh, Mama's so proud of you.
So what do you think has happened since we had his sternum closed earlier in the week?
His breathing's more comfortable, it looks like, and
Yeah.
he's different color. More of a pinky baby.
Ultimately, when you leave to go home, which I hope won't be in too many more days' time, then you'll be back to where you should be with a little baby that's practically back to normal.
That's right.
I'm very, very disappointed. I was hoping to buy dinner. Have a seat.
It was a penny.
It's a penny, that's all. I mean, can you believe it? Not even an American one. I mean, come on. Oh, we're seeing a ton of pennies these days. Lots of money these days. Everything went really well. We're going to do a post-op x-ray. We always do, just to make sure that there's no collection of fluid or anything from a perforation. There isn't. I can tell you right away there isn't.
Okay.
Everything went perfectly. Now, the only thing that's really important is that you buy the kid a piggy bank. All right? All right.
I
It's
thought
just a
at
regular
least
penny.
a quarter.
No.
But
Okay.
thank you.
All right.
A penny.
You're daddy's boy?
There you go.
Have a seat there, Dad, and I'll give him over to you.
There you go.
Give Dad a big hug.
You okay?
No more of those pennies,
Don't
eh?
You see the penny? That's what you swallowed.
It's cold. Do you want me to
Thank
put this
you.
around so it's not too cold? There you go.
Say thank you.
Let me help you. You're welcome, honey.
Good boy. Well, you don't want the car?
Aaron's x-rays have shown that there has been no damage to his airway. 15 hours after swallowing the penny, Aaron is on his way home.
Thank you.
Bye. Thanks very much.
Take care. Take care.
Thanks.
Baby. Come on. Come up here with Mom.
Let's have a look at this young guy. Hi, buddy. Sit down on you.
Oh, here, I'll turn him around.
That's all right. You just keep him comfortable there. That's fine. Look at the way his incision is now. It may get a little more red and raised over the next few months as it heals. That's normal. All these other little spots there should dry up and heal away, and those will become almost invisible by the time he's 6 months to a year.
But that shrinks as he grows, right?
Yeah, that'll stay that size, and he'll get bigger, so it'll be less noticeable. But he looks great.
Except for the haircut.
Well, you know, he's got an NICU hairdo, doesn't he? You guys happy with him and comfortable with him?
I am.
Okay.
He's in the nervous.
Yeah, I'm nervous.
What are you nervous about?
Just
What can I make you feel better about?
well, I
Changing
just
diapers.
touching and like
Okay, well, there's nothing that's going to break in there.
yeah, okay.
Okay. If you're nervous about diapers, well, you can't blame that on anything that we've done here. You were going to be nervous about diapers without us. So safe trip home.
Yes,
Drive safe.
thank you for
Okay.
everything.
Yeah, thanks for everything,
Oh,
Doc.
absolutely. We'll do the left-handed one. Okay. All right. Bye, Paige.
Bye, say thank you.
See you later.
Kiss the baby. Give the baby a kiss. Oh, that's so good. Nice baby Logan, eh? What's his name?
Oink, oink.
It's not oink oink. It's not oink oink.
Logan is now 2 weeks old and is going home for the first time. He will continue to be monitored by cardiologists, but his doctors are confident that Logan will continue to thrive. On the next episode of Life's Little Miracles, Kayla's struggle with cancer and Felicia's hip surgery.